Kia ora koutou katoa. Cabinet met today to discuss the current alert level restrictions in Auckland and to confirm our plan for transitioning the city out of the current restrictions safely and carefully over the coming weeks. I'll come to the details of that roadmap shortly, but first let's go to Dr. Bloomfield for a quick update.
Thank you, Prime Minister. Kia ora koutou katoa. So you will have seen our comprehensive 1 p.m. statement. Just a couple of highlights from today's cases. There are the 29 new community cases, 28 of which are in Auckland, and one is in Hamilton East. It's the case announced yesterday, but in our system today. There are 3 other household members who have become cases, linked to the Raglan case, these people tested positive overnight and will be included in tomorrow's numbers as they were entered into the system after 9 a.m. 7 of our cases today at this point are as yet unlinked and interviews are ongoing. And as of yesterday's cases, 9 of those remain unlinked at this point with interviews and investigations ongoing. We have 12 active subclusters where there are still cases emerging, and these are the focus, of course, for our public health response. Looking ahead, we're expecting at least somewhere between 25 and 30 additional cases just from those close household and other close contacts. And finally, just to emphasise again the importance of vaccination. You would have heard Wellington Intensive Care Dr. Alex Sorides speaking yesterday about the concern that he and many of his ICU colleagues hold around the impact of COVID on our ICU and hospitals. Vaccines, as he said, are the most effective way of keeping pressure off our health system, as they have proven in other countries. There's no doubt that in our current outbreak, vaccination has prevented people from being hospitalised or dying. And in terms of actual cases in our outbreak, whilst nearly 50% of eligible New Zealanders are now fully vaccinated, just 6% of cases in this outbreak have had both doses of the vaccine. That's cases who are aged over 12 who are eligible. So please, if you haven't already been vaccinated, you can make my day by making tomorrow or today your day to be vaccinated. Thank you, Prime Minister.
Thank you, Dr. Bloomfield. Right at the beginning, we said Delta was a game changer, and it has proven to be so. It's been more infectious and more persistent than the previous variants of COVID-19 that we have faced. What we have called a long tail feels more like a tentacle that has been incredibly hard to shake. Having said that, our alert levels and the actions of Aucklanders on behalf of all of us has made a huge difference in this outbreak. Early on, level 4 meant that we were able to contain the spread of the outbreak geographically. The restrictions have also stopped what could have otherwise been exponential growth over a prolonged number of weeks. And that sacrifice, carried mostly by Aucklanders, has given us the gift of time to get vaccinated. At the beginning of this outbreak, we said we were adopting an approach of elimination while we vaccinated. That was the right choice and the only choice. That was because at that time only 42% of Aucklanders had 1 dose and 25% were fully vaccinated. In the 7 weeks since, those numbers are now 84%. And 52%, effectively doubled. So in people terms, that's 387,642 more Aucklanders who are now fully vaccinated. And we can see vaccines are playing an important role. Only 3% of cases in this outbreak were fully vaccinated. Modelling is also now telling us that while we're still seeing cases, they are 50% less than what we could have seen without vaccinations. That's an incredible number. In the future, vaccines will be able to make an even bigger difference. They won't be the only tool we need, but they will be able to act as a form of individual armour, which means we won't have to rely solely on restrictions like alert level 3 or 4 to act as a barricade for us. But while we're transitioning from our current strategy into a new way of doing things, we're not there yet. We need more people fully vaccinated across more suburbs and more age groups. As we do that, we will be in a better position to safely lift those restrictions that are the hardest to live with. But in the meantime, the question that Cabinet working with the Director General and his team, has been asking are, how do we continue to keep everyone safe while looking to find ways to make everyday life a little easier? How do we make the transition from tough restrictions at level 3 to a place where public health measures sit alongside vaccines and life feels a bit more normal again? Together with the public health team, we've designed a roadmap to help us do that. It will take us being careful and methodical, and we all have a role to play. Let me walk you through it. Firstly, the health advice has been that to date we've managed to largely control the outbreak, but as you can see with this outbreak and with Delta, the return to zero is incredibly difficult, and our restrictions alone are not enough to achieve it quickly. In fact, for this outbreak, it's clear that long periods of heavy restrictions has not got us to 0 cases. But that is okay. Elimination was important because we didn't have vaccines. Now we do. So we can begin to change the way we do things. We have more options, and there's good cause for us to feel optimistic about the future. But we cannot rush. That's why we need to continue to contain and control the virus as much as possible while we make our transition from a place where we only use heavy restrictions to a place where we use vaccines and everyday public health measures. We need to keep using the tools we have. We need to vaccinate. We need to test. We need to find cases. We need to isolate them and actively control any outbreak now and in the future. This is a change in approach we were always going to make over time. The Delta outbreak has accelerated that transition, and vaccines will support it. So what does that mean for our next steps for Auckland? Over the past week, the public health team has been analysing each of the restrictions that we have and assessing which of these have played a key role in controlling this outbreak. That analysis is being used to identify those restrictions we believe can be eased while controlling the virus to the best of our ability. This phased approach is in 3 parts. At each stage, we will assess the impact of the previous phase before stepping down further. Step 1, Cabinet has already confirmed, will come into place from tomorrow, Tuesday, 5 October at 11:59 p.m. Here, Auckland remains at level 3, but with several key changes. The first, Aucklanders will be able to connect with family and loved ones again, but only outside. The science tells us COVID finds it hard to spread outdoors. So from midnight Tuesday, Aucklanders will be able to meet another household outside with a cap of no more than 10 people at any given time. Children can have a play date in a park. Friends can meet outside for a walk, a picnic, or a beer. You can slowly see people you have missed over these past 7 weeks, one household at a time. But please, it may sound like the outdoor part isn't relevant, but it is in fact the most relevant part of all. Keep it outside. This part is absolutely fundamental to this change. The natural ventilation provided by being outside makes it hard for the virus to spread, which makes outdoor gatherings the safest option. I know one of the hardest things about lockdown is not seeing the ones you love, but we've also seen that in this outbreak, families getting together has led to cases spreading. But by gathering outside, we can balance both these issues. So please, be careful, wear a mask. If you take them off to eat or drink, keep your distance, give other groups a wide berth, but reach out and see people. I know it will help get people through. And just to be clear again, I've got a long way to go yet, Jessica, sorry. Just to be clear again, that's 2 households, a maximum of 10 people at any given time outdoors. The second change is the return of more children to early childhood education. At Alert Level 3, children have been going to early learning services where their parents or caregivers have to go to work and there are no options to care for them at home. Our public health team believe that with the right precautions in place, including limiting the size of groups to 10 children within a bubble at an ECE, strict infection prevention and control, the risk posed by the return of ECE is low. Early learning services can welcome more children back from Wednesday. The exact number will depend on the number of bubbles of 10 children they can manage on their site. And you'll remember this was an approach we took with our original lockdown. Parents, caregivers and teachers will also need to wear face coverings during pickups and drop-offs. Early Learning Services will contact parents in Auckland about the plan for their service and options for their children. To ensure this is done as safely as possible, though, we're encouraging early learning teachers to get tested alongside other Aucklanders who've returned to work. And we'll look at options for more regular but less invasive surveillance testing going forward. This is an added precaution and an acknowledgement that our children of that age cannot be vaccinated. And the final change for this first phase is the ability to move around Auckland for recreation purposes. You'll be able to visit the beach, play bowls, sail, hunt, do outdoor CrossFit or yoga classes. All must continue to comply with the rule of being outside and keeping it to 10 people physically distanced. This is the first phase of our gradual transition. Some may ask if this is a risk to the current outbreak. Here I think it's important to note that the public health advice is that these changes are unlikely to contribute to uncontrolled growth in the outbreak. But we will monitor the situation very carefully to give us confidence as we move. At the same time, we believe these changes will make a material difference to Aucklanders' ability to maintain the restrictions that we have in place. These are all things we've taken into account with this decision. I'll now set out the next 2 steps in our phased transition. We do not have a date for these steps, but we will make an assessment of our readiness to step into them on a weekly basis, starting from next Monday. At step 2, we predominantly remain in level 3 with some further changes. Retail will be able to open their doors again. Once open, the usual measures for retail will apply. People will need to wear face masks and keep up physical distancing. Public facilities will be able to open again. That means places like libraries, museums, pools and zoos would open. At this step, we'd also intend to increase the number of people who can meet outdoors to 25. The third phase of our plan then brings back those higher risk settings. Here, hospitality, such as cafes and restaurants, will be able to open, but with the precaution of seated and separated with a limit of 50 people. Close contact businesses like hairdressers will also be able to reopen at this stage, with the usual mask use and with physical distancing. Gatherings at this stage would also extend to 50. These are the 3 phases of our transition that our public health team have designed and that has been approved by Cabinet. Alongside these phases, the separate question of the reopening of schools has been considered. Here, we'll need to assess our progress as we lower restrictions, but the current public health advice, if we move carefully, is that schools will be able to return after the school holidays on the 18th of October with a range of precautions in place. We'll continue to review this preliminary advice, and we will signal in advance of the 18th of October this final decision. In the meantime, if your child is aged 12 and older and is not yet vaccinated, we strongly urge you to use the coming 2 weeks to get them vaccinated before school reopens to make the transition safer for everyone. In total, this phasing amounts to a careful and methodical transition plan for Auckland. As I said at the beginning, movement to each phase will be reviewed weekly. We'll need to assess the impact of each before making further alterations, but ongoing increases to Auckland's vaccination rates will also be essential to giving us confidence. Now to cover off quickly some additional important information. The easing of Alert Level 3 restrictions here that I've announced today will not extend to the Northwest Waikato area Level 3. Current restrictions there are intended to be temporary measures while we get more information from contact tracing and community testing. But while we do that, we're keeping a simple Level 3 arrangement for that area. As Auckland moves through all 3 phases of the plan we've set out over the next few weeks, I can confirm that the wage subsidy will continue to be available on the current settings. Auckland is still, for the most part, at Alert Level 3, and therefore the policy rationale for the continuation of the wage subsidy has been met. So just for clarity, all 3 of the stages I've set out today, the wage subsidy will still apply for. As has been previously indicated, the resurgence support payment will be available in 3 weekly instalments, so as long as anywhere in the country is at Alert Level 2 settings. We'll update these policies as we transition to the new framework. You may have noticed that these 3 phases don't bring everything back online, like large-scale events in Auckland. That's because at the conclusion of this 3-stage transition period, we will likely move to a framework that reflects a more vaccinated population and the ability to use vaccine certificates as a tool in the near future to reduce the risk of the virus spreading, especially in crowded indoor settings. This is our best pathway back to gatherings. We're currently talking to our event sector and hospitality around what this framework looks like, and we'll present the details on that plan next week, well in advance for any implementation of that framework so that people can prepare. In the meantime, the rest of New Zealand needs to continue to support Auckland to do the heavy lifting for the rest of us. This means we'll be staying at alert level 2. The cases we've seen in the Waikato and the driver who has visited Palmerston North are a very clear indication of the need for us to maintain that stance. I know it's frustrating for communities such as those in the South Island that have not had a COVID case for a very long time, but it's important to remember that the reason there have not been cases is the careful and cautious approach we've taken, and we don't want to risk unnecessary lockdowns. In the meantime, as we have throughout the pandemic, we've reassessed the settings at level 2 to see if there are any further ways to ease those settings and maintain a cautious approach, and we believe there is. Currently, we ask hospitality to be seated and separated with 1 metre between customers. We then overlay a cap on the top. The view of our public health officials is that for the rest of New Zealand, we can remove that cap for hospitality. The seated and separated rule will provide the safety we need. This will also apply to other events spaces, and we'll issue guidance on this. Because social gatherings do not use the seated and separated rule, the limit of 100 will continue to apply for these. But right now, the single most important thing that people outside of Auckland can do if they want to see the return of large-scale gatherings and events is get vaccinated. Or even better, if you are vaccinated, support and encourage someone who isn't to get along to a centre this weekend. Tomorrow, I'll set out our plan for the final stages of our vaccination campaign and activities to drive our numbers up even higher. On Thursday, we'll provide an update on the testing strategy going forward. At Cabinet today, a report prepared by Professor David Murdoch from Otago University was presented. Professor Murdoch leads our testing advisory group, and his work will form the basis of a new rigorous testing regime that will be central to our strategy to control the virus going forward. To conclude, and thank you for bearing with me for a lot of information to impart this Monday afternoon. Vaccines will mean that in the future we can do things differently, and that change is within our sights. But even then, our strategy remains that while cases will continue, we want to control the virus, stamp out cases and prevent hospitalisations. But with vaccines, we have more options on how we do that. But that does mean we need you to be vaccinated. I've heard some people who are willing to be vaccinated say they're waiting for just a little longer till they make that choice. They may not be worried about the immediate side effects, but they want to see long-term health effects. I want to give you the assurance you need that the vaccine is safe, but I encourage you to have that conversation with your trusted medical professional. But please, do not wait. Maintaining control of COVID, easing restrictions, it relies on the help of the vaccine. It's already making a difference, but we need everyone to do their bit wherever you live. This is not an Auckland problem, but rather a solution that only the team of 5 million can deliver on, and we need everyone to play their part.
Now that we're moving away from the elimination strategy, does this mean no more level 4?
Well, in the future, as we've said, our goal is to move to a highly vaccinated population so that we don't have to use blanket level 3 and 4 restrictions in the way that we have to date. And you've heard us talk about that extensively. And now it is within our sights to achieve those high vaccination rates. We just need the help of every New Zealander. In the meantime, we are in a transition. We are not ready to remove the really strong approach that we have taken to COVID-19. We will continue with that. We will test, we will trace, we will isolate, and we need everyone's help with the restrictions to continue with that focus.
You mentioned in any of those phases about the boundary around Auckland. When's that likely to be?
No, we'll keep that under constant assessment as well, basically as we move through, but we haven't set a specific date. It's something we'll keep under constant advisement.
Before that third phase, though?
I wouldn't necessarily rule that out. We'll continually monitor the role of the regional boundary. Yeah.
Minister, with
Yeah,
the case
Jessica.
numbers, we've had almost 90 cases in the last 3 days. If you're now feeling like it's safe to ease off and have some more freedoms in Auckland at level 3, why not have done that a week ago?
Well, perhaps given it that we make all of our decisions based on the health advice, I'll have Dr. Bloomfield.
If this is a political decision, because Auckland have been
No.
really feeling the... Well, I mean, there's got to be some of it in there, though, because Auckland...
I guess I wouldn't consider that political, I guess is what I would say. Look, the decision that we have to make as a cabinet is one that does rely heavily on the health advice that we receive. And what we asked health to do and what they did themselves was some time ago, go through and look at individual restrictions rather than just saying, can we safely move in one leap to level 2? Go through individual restrictions and look at those that will have the least risk attached to them, but will also make a significant difference to Aucklanders and their ability to continue with the restrictions that do help us with this outbreak. Their view was that outdoors is a safe place for us to be. So they were comfortable in allowing 2 households up to a maximum of 10 to meet outdoors. And I have no doubt that whilst being a small move, will make a big difference to people. Perhaps for the...
Thanks, Prime Minister. So, yes, our advice, of course, a couple of weeks ago was to hold Auckland in alert level 3 through to today. And the team's then done quite a bit of work elaborating really this sort of stepwise process. And I think this is the important feature of this next 4 to 8 weeks is being methodical and stepwise and doing it safely.
Yeah.
As our vaccination rate goes up, that helps, and it's already helping, as the Prime Minister said. So it's great to see that vaccination rate still climbing up. We want to obviously see it over 90%. And the second thing is we looked very carefully at the things in each step that would not increase the risk much at all. And we advised, and this advice has been taken, that it is reviewed on a weekly basis, and is on the basis of that review each week that the decision is taken to move to the next stage.
I think I'll let you finish, Jessica, and then I'll come to Jane.
With the elimination strategy, you asked us all to buy into that, and I think the team of 5 million did. Are you disappointed that that's now had to go?
No, not. And look, just to be clear, the elimination strategy has served us incredibly well and was the right thing to do for New Zealand. And 7 weeks ago, entering into the elimination strategy, which is stamp out cases, was the right thing to do. And for now, as we transition, continuing to stamp out cases is the right thing to do. But over time, we were always going to have to move to a place, and intended to move to a place, where our vaccines helped us, so that we didn't necessarily, every time we had a single case, move ourselves into alert level 3 and 4.